Thanks for stopping by our article here. In this brief report, we describe the process of bringing a trained and validated machine learning model into live clinical practice. And we describe this in the context of our experience bringing the first internally developed machine learning model all the way into live deployment here at Mayo Clinic. And the model that we worked on specifically is designed for predicting which patients in the emergency department will ultimately need hospital admission. I'm Alexander Ryu. I'm a senior associate consultant in hospital internal medicine here in Rochester and also serve as the vice chair of AI innovation for Department of Medicine and the Hospital Internal Medicine Innovation Committee chair here in Rochester. And we are really excited to bring to publication our article, A Clinician's Guide to Running Custom Machine Learning Models in an Electronic Health Record Environment for the March issue of Mayo Clinic Proceedings. So in this article, we describe the process of bringing a trained and validated machine learning model into live clinical practice in a cloud EHR environment. And we do this in a way that's sort of agnostic to whichever EHR system your health system may be using. But in broad terms, we describe the steps here of initially converting your data sources into the live data sources from most likely you use retrospective data to train your model. And some of the hurdles that may be associated with that. And we describe kind of the specific hurdles that we face and how we overcame those. But in our case, some of the feature engineering that we had used for our retrospective data was a little bit more constrained in the live environment, and we couldn't do some of the things that we had initially done with the models. So we had to remove a few features, but fortunately that had minimal impact on our model performance. We then took the model into the development environment associated with our EHR and had to overcome some challenges there as well, in that we were running the development environment in kind of a unique scenario rather than as a local deployment. Our development environment was run through a separate cloud vendor, which posed some unique challenges for getting our code to sort of work as expected. And then when it came to deploying our score after it had been validated in a development environment and verified that scores were displaying appropriately, we described kind of the process of the workflow implementation of this particular score, which is for predicting which emergency department patients will require hospital admission in the clinical workflows, and sort of the considerations that we had for making sure that this integrated well with our emergency department workflows and that the scores were displayed in a meaningful way. And then going forward, once the score was in live implementation, we described some of the troubleshooting that we did to make sure that the performance in the live environment was actually consistent with what we were seeing in the retrospective data, and sort of the different roles and responsibilities that have evolved along with that process, because this was actually the first machine learning model brought into practice from in our live environment. We helped to sort of develop the model maintenance and monitoring processes that are associated with that. So what we hope to offer is both for our hospital internal medicine colleagues and ED clinicians is sort of a forward-looking view on which patients might need hospital admission and sort of providing a predicted probability there very early in a patient's emergency department course. And this, we are hoping, facilitates review of appropriate patients for either expedited hospital admission or for outpatient follow-up, and can really initiate and facilitate discussions between hospital internal medicine and the emergency department clinicians on how to make that happen best for patients, again, with the aims of overall improving hospital overcrowding and facilitating care for patients in sort of an expedited fashion who are in the ED. In terms of what this means for patients, our hope is that other clinicians can read this article and ultimately introduce additional useful and impactful machine learning models into practice that can help patients through a variety of means, whether that's improving kind of the efficiency of care processes or facilitating more accurate diagnosis or timely treatment. Our hope is that this kind of roadmap that we've published here is an enabler for others working to bring machine learning models into practice and ultimately improve care for patients across a variety of settings. Mayo Clinic's a particularly unique place to be doing this type of work because, as you can see from our author list here, there's a variety of resources that came together to make this kind of work possible, from Mayo's deep data resources to our cloud infrastructure to the depth of expertise across IT, data science, and clinical medicine. And it really sort of made for a unique environment where we were able to accomplish this work on a fairly short timeline through everyone's combined expertise. So now that we've completed this work and we've brought our machine learning model into live clinical practice, we're actually really excited to be starting a randomized controlled trial of this model to see how it impacts operations in the emergency department and whether it is indeed facilitating proper sort of expedited disposition of patients as appropriate, and potentially addressing issues with hospital overcrowding. We'll be doing that by turning the model on and off every 2 weeks and sort of evaluating any changes in ED operations during those times. And finally, for further details, please check out our article, and there you'll see sort of a detailed explanation of all the processes that we've gone through, the hurdles that we encountered along the way, and we'd love to hear from you if you have any questions or want to discuss further.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.